Hi, Kevin Henry, the Group Editorial Director for Advanced Star and Dental Products Report, and I'm on a Google Hangout today with my good friend Teresa Duncan. Hey, Teresa, how are you?
Hey, Kevin. I'm good. How are you?
It's good. Always good to see you.
Good. Thank you.
Many of you know that we shot a video together at the American Association of Dental Office Managers meeting, commonly known as ADOM, back in September in Orlando, and it's been a huge hit on DPR.com regarding Obamacare, the Affordable Care Act, and how it's going to affect the dental practices around the country. And Teresa has really spent a lot of time looking into this, so I'm really glad to be able to pick her brain on this. And Teresa, that was such a hugely popular video that we shot together 2 months ago. Tell me how things have changed since you and I were together in Orlando regarding the Affordable Care Act.
Wow. Well, lots has changed, hasn't it? I mean, the president has taken on some press conferences to acknowledge the fact that the website wasn't ready, and even extending the ability for insurance commissioners to sign people back up for their plans, which I'm not sure how that's going to work out. The insurance commissioners are not quite sure how that's going to work out either. So lots has changed, but unfortunately nothing concrete is ready for me to report. As far as it concerns employers, dentists as business people, you just published a great piece on your site on how that will affect you as an employer. So I'm not really monitoring that part. I'm really taking a look at how it's going to affect us as an industry, and it just hasn't changed except for the fact that if they allow people to keep their old plans, then we don't see too much of a change. Now, if that doesn't work out and the insurance commissioners say, nope, we can't do it that way, then we are looking at rolling up the pediatric dental benefits into the medical plans.
And so what are some of the big questions that you're hearing from dentists whenever you're out there speaking on this topic?
Well, the big question I get is how am I going to know that this pediatric dental plan is part of a larger plan, or is it a standalone plan? And so we have to keep in mind that that's going to be an important distinction. So you have the standalone dental plans, which is how we've always operated. So that's what we're used to seeing is the standalone plans. They're called carve-outs, and they're totally different than the medical plan. Now, if you have a pediatric dental plan that's now part of a medical plan, then there's a whole different animal that we have to work with. And the reason I say that is that the medical plans have these very large deductibles. We've been hearing about these large deductibles on these new plans. So they have large deductibles, and they have different out-of-pocket limits. And now what we're looking at is possibly with these pediatric plans, those benefits aren't really going to be helpful because of the such large deductibles. So it's almost like having no dental benefits at all. And so that's going to be the difference. When you get a card that comes in, and it's a medical plan, and it's just got like maybe a PD or a D on it that notes that it's a part of a medical plan, then you're looking at a whole different deductible, a whole different maximum. If the card that you get looks the same as what you're used to dealing with, it's a standalone plan, there's no medical component, then it's kind of business as usual. So that's really the important distinction that offices beginning in January are going to have to keep an eye out for.
So how do they prepare for that? Is there something they need to be doing now to get ready for that January change?
Well, unfortunately, it's going to be like what we deal with most of the time with insurance, is it's going to probably mean some phone time. And so when you get a medical card that has that distinction, and the dental plan is part of the medical card, I don't have any other advice for you except pick up the phone and call and ask how it's going to work out. I would prepare your patient for the fact that most of the work that they're getting done is probably going to be subject to the deductible, which means they're going to be paying for their benefits themselves right at the time of service. It leads to a collection issue, of course. If we don't collect that money at the time of service, the chances of collecting it later are a little bit, they're less. They're 50-50, I like to say. They're either going to pay it or they're not going to pay it. And so if you do see that medical card, get on the phone and warn your patient that it's probably going to be an extra expense for them.
And Teresa, let me ask you a question, because one that I'm hearing a lot, and it's in regards to the pediatric, is there are some dental practices, as you know, that really don't want to have pediatric patients in their practice. Under the Affordable Care Act, are they required to take on these patients, or can they still, keep those patients out of their practice if they don't want to have any pediatrics?
If you didn't accept them already, then you're not. You don't need to. The distinction is now, if you were a Medicaid provider previously, then you're now, most of those plans that are being sold on the ACA exchange are Medicaid plans. And so if you were already a Medicaid provider, then you're going to need to still accept those until you register with the state and say you're not accepting any new patients. But if you're a traditional dental practitioner that never dealt with Medicaid, you don't have an obligation to take those patients on if you weren't already a provider.
Okay.
Good question.
And is there anything else that our viewers need to know about what's going to happen in January and how things are going to change?
Yeah, I'm a little concerned about the wording. There's some wording in the ACA that has to do with the orthodontic section. And so previously our orthodontia was always paid for, with our kids, it was always just paid for. It was a benefit, right? We never really had to justify it. It was the adults we always had to fight for. But for the kids, we never really had to justify it. The wording in the ACA now claims that orthodontic benefits are part of the pediatric dental benefits, but only if it's medically necessary. And that, to me, is one of those terms that whenever I read in a plan, medically necessary, that means that I'm going to have to send in a whole bunch of documentation or just to count that it's not covered at all. And so the National Association of Dental Plans, who has been a tremendous resource, I do urge your viewers to visit nadp.org because they always are releasing little press releases on this type of thing. They're monitoring that to see if medically necessary is something that actually means orthodontia not covered. And for those orthodontists in the country whose maybe their heart just stopped a second, don't get scared. We're still looking to see how that's going to pan out. That would apply to those plans that are covered with the medical plan. Okay, so the standalone dental plans probably will not. I would not think that they would adopt that language only because it's such a good selling point for their dental plan. So don't get scared, but we do have to be aware that that is something that could be further defined in a little bit. One thing that I'd just like to say too is, as far as I get a lot of questions of, so it's only for kids, right? We don't have to worry about it. Right now, we don't have to worry about it. And I don't want to be a fear monger because that's not my goal here. But right now, adult dental benefits are not part of the ACA, but that does not mean that they may not be down the road. And so it's so important for your viewers to keep up with your magazine, with what I do in my newsletter, to keep up with the announcements, because if it ever gets to the point where the lobbying organizations get adult dental benefits into that ACA, then that's really going to change our industry. I'm not saying it's going to happen anytime soon. I just want us to be aware of it.
You know, we talked about education and patience being such two virtues whenever we were together in September, and it sounds like that those are the same exact things that we're still talking about as we're heading into January 1st.
Absolutely. And, you know, we might even do this call again in February, and you'll say, what's changed? And it might be a whole different ballgame. So it's ever-changing. This is probably the most dynamic the healthcare field has been in the last 20, 30 years, not since when they implemented Medicare. Has it been so uncertain for almost everybody? So yeah, we got to watch it carefully.
Well, I will tell our viewers that Teresa has been one of my friends for a long time, but she is also one of the most knowledgeable people out there when it comes to the ACA and how it's going to affect dentistry. So Teresa, I appreciate it, and I sure want you to tell our viewers how they can get more information about you and how they can reach you if they've got questions.
Oh, sure. My website is Odyssey MGMT. My company is Odyssey Management, so visit me at odysseymgmt.com. Sign up for my newsletter. Happy to add you to it. Next upcoming newsletters are going to focus on the new dental codes that are coming out. We've got over 50 starting in 2014. And I just launched a new service that your readers might be interested in, which is called Billing and Coding eSupport, which is going to be a hotline for you to get your questions answered. It'll be a monthly subscription-based, and this has been in response to a lot of doctors just saying, can I have you available? You know, can I just have you available to ask my billing questions? And now I finally got the ability to do that. So if you're interested in something like that, please check it out. But yeah, I hope that you find me online. You can find me on Facebook and Twitter as well. So yeah, looking forward to connecting.
Teresa, as always, thank you so much. I really appreciate it.
No problem. Thank you so much.